got a letter from, I got a letter on 15th of April, and then the clinical date was 30th March. So that is the time, and that is the male consultant I saw on that day. So here's the clinical review I just want to mention. Seen in ED last week due to sinusitis and wisdom tooth infection. Had 24 hours of IV antibiotics and then was discharged. Previously had 1 day of Clatterbridge, sorry, I'm not a pharmacist or a doctor to pronounce that name, and 3 days of metronidazole. Feeling increasingly unwell generally, but facial symptoms improved, particularly with steroid nasal spray. Okay to take pre-bone marrow biopsy. I haven't taken steroid nasal spray. It was more a normal nasal spray without steroids, so because they didn't have steroid nasal spray at the pharmacy at the Oldham Hospital. I explained that the lymphoma node biopsy did not show lymphoma, but we are still convinced that she has lymphoma given the PET CT scan results and rising paraprotein. I don't know what's the paraprotein total. They didn't write in here. It could well be Waldenstrom's Macroglobulinemia, but it would be good to prove that the first before starting targeted treatment, Zanubrutinib. I don't know what kind of targeted treatment is that, but all I know this is the oral tablets, which I'm not keen to take, but this is for low grade. It's not for high grade lymphoma, so for low grade lymphoma if they suspect that. If the biopsy shows high grade lymphoma, we would commence chemotherapy-based treatment and consider consolidation with a high-dose chemotherapy BEAM, BEAM, and stem cell rescue. He does the stem cell transplant situation, so he is the person. Given the failure to find the lymphoma with lymph node biopsies, despite good samples, this is actually the right side of the axilla, meaning right side of my armpit they did, and I still bruised, by the way, still got the marks. So we're still left with the options of a bone marrow biopsy or splenic biopsy. I'm not really keen to do splenic biopsy. That's why they did the lymph node biopsies as a safer option, and also the radiologist was not keen to do it because he knows I'm going to bleed a lot, and I don't know why they want to do that, but I guess it makes sense. The former being the safer, but possibly less likely to confirm the lymphoma. He still is doubting that. She was against the idea of having bone marrow under local anesthetic despite extra analgesia, gas, and air sedatives. Therefore, we are exploring the option of doing the bone marrow biopsy test under general anesthetic. Plan: bone marrow biopsy. To start steroids post-biopsy, I will get to stop steroids right after biopsy. That's what I've been told by the CNS, but I don't know if that can change according to whatever they mention here. To review an entity with histology. Yours sincerely, electronical, signed by Dr. Consultant Haematologist, copy to your GP. Now, normally what happens is that when a letter comes, it says CC reference, date type, clinic date, enclosures, internal mail, urgent fax, and your full name and address. And it says your title, miss, and then your surname. And then your surname, and then your first name, and your date of birth, and then your address, and then your NHS number, and your CC hospital number. And then it says diagnosis, treatment, summary. Waldenstrom Macroglobulinemia, lymphoma, plastic lymphoma, V versus MZL. High grade transformation 2021. Sorry, I'm actually having a bit of anxiety when I read this, actually. Again, MYD88 on sample by HODS not available due to insufficient DNA. I just want to mention that it was negative. I don't know why they said insufficient when it actually was negative, according to my previous, which was from MRI. This is Clatterbridge. There's two different ways how they write things down. Okay. Then it says treatment history. RCHOP chemotherapy times 6 completed September 2021 marked improvement in IgM paraprotein lower 35 to 2.8 GL. Currently active monitoring under the care of ULCH and CCL. University College of London Hospital, that's what it stands for, and Clatterbridge Cancer Centre at Liverpool, that's what it stands for. Recent presentation to Oldham Hospital with Abbey, Texas, don't know what that is, SOB, abdomen pain, CT demonstrating splenomegaly, meaning enlarged spleen, and enlarged LNS, must be the lower neck, maybe the enlarged lymph nodes or something. PET CT scan, avid lymphadenopathy above and below diagram, massive splenogamy, bony lesions, asymmetric nasal thickening for urgent ultrasound guided biopsy. L lower, like left side neck and X-ray biopsies. No evidence. So the right side of the armpit. No evidence of lymphoma. Sufficient tissue granulomatous appearance, meaning that it looked big, but it was just the normal tissue, and they didn't find any lymphoma, and they got inflammation situation there. Comorbidities: early primary ovarian failure based on hormone levels, followed by long-standing abdominal pelvic discomfort and heavy periods. I haven't had periods since the third cycle of July 2021. Under endocrine team at Christie Hospital. Yes, I still go at Christie Hospital, which is an Oldham hospital, not in the Greater Manchester. Just information you have. Vitamin D insufficiency despite taking vitamin D 400 units daily. Try to do that. I don't. Just have to be very honest with you guys now. Gastroesophageal reflux. I am experiencing GERD. Yeah, that's unfortunately. Joint pain under specialist pain control team. I've had bone pain since 2020, so 6 years, guys. It has mentioned in the pain doctor as well. I will be able to read that next time, inshallah. I mean, urinary tract infection, UTI infection, late 2024. Dental abscess, February 2025. That's why I had in March, the root canal treatment. Honestly, that was just awful. And now we have wisdom tooth abscess. I still need to yet go to Northern General Hospital for the x-ray, which I haven't. I will try my best to go either tomorrow or the day after tomorrow. Let's just see. Anxiety under local health mental team. Fair enough. Social history, lives alone, not working at present. Then it says medication, vitamin D, 400 units in the AM because I don't take 2 times a day. Allergies, aperphine, gastro reflux disease. That's why. Is patient on SACT? I don't know what that means. No. Is patient unfit to proceed? No. Performance status 0 to 5, 1. I'm assuming 5 would be great. He put 1. And this is my male consultant, so he rated that, not me. And I'm reading from a letter, which I can't show you because there's a lot of details about my information, and we're not lying about our cancer. Thank you.